Want to stop paying so much money for health insurance? Let's talk about that. Mike Hodges here, Benefit Partners Direct. This is the second in a two-part video series of how to stop paying so much money for health insurance. In the first part, we talked about how the first step that you needed to do was to determine what your risk factor was. How much of a risk are you to actually use the kind of comprehensive services that health insurance plans cover? The second one is to consider the other side of the equation, which is how much you can afford to pay. Let's look at your finances and your risk tolerance. So the first thing we want to point out here is that you're not going to beat the system. Okay? You're not going to have your cake and eat it too. You are not going to have a plan that protects you in the event of a catastrophe, covers, all your doctor's visits with a very low copay, pays for the eyeglasses, the dental work, everything, and then has a very affordable premium each month. That simply doesn't exist. That's not in the market, so you're going to have to make a choice. In general, the more you pay in premium, the more generous the benefits you receive are. Now, there are some people that makes a lot of sense. They might be very sick. They might be, for example, even not terminally ill, but they might have cancer or serious heart problems or serious risk. The best solution for them might be to go into the Affordable Care Marketplace, get a plan with a very low deductible, even though they have to pay a high amount each month because they're relatively certain they're going to be sick and they're going to get a lot of healthcare expenses down the road. Another person might say, look, I'm really healthy. I rarely, if ever, go to the doctor. I don't see myself needing all these things. But, my important thing is I need to save money now. I need to, these monthly premiums are killing me. Well, that's great. Then what you do is you sit down and you work with a plan that maybe doesn't have all those benefits, doesn't cover all of those things, maybe has a higher deductible for certain things, and then finds a way to hedge those bets a little bit. There's a number of different ways you can do this. A lot of different products that I don't want to go into specifics because it gets a little confusing when you start throwing out all the options that are available. But the important thing that you'll have to decide is what is your risk tolerance? How much can you afford to risk? And make sure that your benefits that you have and the premiums that you're paying make sense for you. It doesn't make a lot of sense to say, oh, I have a health insurance plan and it's nice and affordable. It has an $8,000 deductible. But if you got really sick, you'd be bankrupt if you had to pay $5,000. Right? That doesn't make a lot of sense because obviously your health insurance isn't helping you. If you are probably going to go bankrupt if you have to pay $5,000 out of pocket, you need to come up with some sort of a plan that can provide that uh, those catastrophic benefits under that price threshold, and something that doesn't kill you each month in the process in terms of your monthly premiums. It is possible. There's a lot of options out there, but the first thing that we have to do is to have a realistic understanding of what are our risks, what are we likely to incur, and then what is our risk tolerance? How much can we afford to pay each month? How much can we afford to pay when we go to the doctor? What's the most in any one year that we could pay before it would just crush us and we'd be done? Now, these are all the kinds of things that you need to sit down and have a serious, intelligent, well thought out discussion. Anybody who would like any information on different types of options that are available, please reach out to me. I'll be happy to help you. And if you like this video, please, I'd appreciate it. You give it a thumbs up, share it with your friends, come over and like our pages on LinkedIn, Facebook, YouTube, and Instagram at Benefit Partners Direct. I hope this has helped. Take care. Have a great day. Bye now.